Hi, hello. I'm Justin Riel with the Arizona State University, and I'm pre-veterinary medicine student, and I'm here to talk about the uh, leishmaniasis, an emerging disease in the United States. Uh, so, what is leishmaniasis? Well, it's a parasitic disease caused by the Leishmania species. They are vector-borne, so they're transferred through or transmitted through mosquitoes or sandflies. They're zoonotic, which means a lot of mammals can contract this or be infected with this parasite. Humans, dogs, cats, bats, you name it. They are endemic to the tropical and subtropical regions of the globe. You don't see it too much in the United States, but this is why we're talking about this today. And contracting this disease can be fatal because of treatment and vaccines not available. And here we see a list of some of the within the animal kingdom that we have found these parasites as using their host as reservoirs in coyotes, foxes, bats, armadillos, possums, rabbits, sloths, humans, and hamsters. And here we can see the life cycle of the Leishmania parasite. It goes into the bloodstream, neutrophils attack it, and macrophages will attack the neutrophils that have already consumed these promastigotes. And within the macrophage, the promastigote starts to differentiate into a mastigote, then multiply itself, and then it eventually kills the macrophage and bursts back into the bloodstream, where it will infect new cells and other organs. And then another sandfly will come in and take another meal or take a blood draw from the infected host. And another cycle begins within the sandfly, where differentiations go from amastigote to promastigote. And here we can see the plot does a demonstration of when the healthy sandfly takes a bite from an infected host. So it ingests these mastigotes that have been floating around in the bloodstream. And once these mastigotes are consumed within the sandfly, they go through differentiation, become promastigotes. Here, where they will have a tail, and then they'll wait patiently until the sandfly goes and infects or takes a bite out of a healthy animal or healthy host. And here we have a healthy dog, where the sandfly takes a bite and injects these willing promastigotes into the bloodstream, where it will be attacked by neutrophils and macrophages to consume them, which is a part of our immune system. And then, the macrophage, thinking that they are the hero, that they've killed the parasites, and eventually it does. In some mammals, it can kill these parasites, but for the most part, it doesn't. And it just multiplies within the macrophage, goes through differentiation first into a mastigote, and just burst out into the bloodstream, where they will just infect new cells. And then a sandfly will come back, bites the infected host, and that's the cycle just keeps going around in circles. And so, when we look about it in North America, we have to think about climate change, globalization, the symptoms of the disease or signs of it, how to prevent this disease, and what vaccines are available for us. And so we're going to look at the threshold for our climate today for tropical and subtropical climate. There was 4 degrees north and 4 degrees south. These are the regions that the sandflies and these parasites are usually in these areas. With temperatures rising, that's going to expand the threshold for these regions. Traveling has become much easier with and attainable because of cheap flights, people making more money, and that so with that is visiting endemic regions and bringing them back into non-endemic regions, and the importation of the animals as well, with dogs and cats and other mammalians going into from these endemic areas. And so here we look at clinical and subclinical signs. They could pass with a bill of health from an inspection agency. And so I have this patient on the left who has no signs of leishmania, but PCR tests have proven that he has that it was infected with leishmania. And the patient I have on the right, who I've lost to the disease, she clearly showed clinical signs. You can see severe alopecia, scaling around the eyes. There's some lesions on her skin, on the ears, and long nails, which is a clear sign of leishmania. The PCR test was done, and a serological test which showed titers in the antigens in her body. She eventually succumbed to the disease as it attacked her organs. Repellents are available, but they won't kill these sandflies. Therefore, topical insecticides are much preferred. You can use collars, you can use sprays. They are available on the market. We don't have any vaccines here in the United States, and they are available in Brazil, and 2 of them are available in the European Union. However, we do have to request a permit from the CDC to be able to introduce these vaccines into the country. Rapid PCR tests would be preferred to screen, especially since we are a non-endemic region. If the patient is positive, then a serological quantitative testing would be preferred to see the titers, to see the numbers, so that we can see that what kind of antibody or how many antibodies are within the blood of the patient. Using glucocorticoids are not recommended, as this affects the immune response. Again, some dogs and cats can fight off this infection with just their immune system. So use of glucocorticoids could affect that if the dog or the host would be able to do it alone. Allopurinol would be needed to treat the symptoms if an animal is infected with it. Again, there's no vaccine for humans. So if our pets get it, we are also susceptible to receiving this infection through a vector such as the sandfly. And here we have many reasons why leishmaniasis is going to be here in North America. We've had soldiers coming back from the Iraqi war back in the 90s and early 2000s, where they were symptomatic, and then later on in the years, they have developed these visceral leishmaniasis. Immigration has been much easier within these endemic regions, and so they're bringing it into the United States. Climate change, we're going to see an increase in temperature, which is going to expand the threshold for the tropical and subtropical regions. Our sandflies here in North America, the Maya Shannoni and the Cruciate, their niches are going to shift when the temperature begins to rise. So they'll even go further from where they are located now, which is in our deserts and our subtropical regions. We've had children born in the United States with the leishmaniasis from a parent who had asymptomatic or non-clinical signs of leishmania when they immigrated to the United States. And we even had dogs with leishmania already in their system, but they were asymptomatic when they went through clinical screening. So I want to thank you for listening to this presentation on leishmaniasis. Feel free to reach out if you have any questions or concerns. Thanks.